So thank you everyone for joining us. I'm so incredibly excited to introduce you to Dr. Puneet Mason. Dr. Mason is a reproductive urologist who specializes in male infertility, an area that's incredibly important, but not always talked about enough. Today, Dr. Mason is going to walk us through Male Infertility 101, and we'll be answering your questions. So you can put them in the Q&A box or in the chat, and Dr. Mason will try to get to as many questions as he can. So with that, I'm going to kick it off to you, Dr. Mason. Thank you so much for being here. It's so good to see you.
Thank you, Emily, for that introduction. Hello, everyone. Thank you all for taking the time to have this conversation this evening. We want this to be as pretty informal, so please ask whatever questions you want. We'll do our best to get to them. So just something about myself. My name's Dr. Puneet Mason. I'm a reproductive urologist. I've been in practice for about 13 years, and doing what I do, taking care of couples when they're trying to conceive a pregnancy and focusing on the male. It gives me tremendous joy and satisfaction in my life. I actually love this profession. I feel so lucky and grateful that I get to do what I do every day. So, many of you might be wondering, why is male fertility care important? Well, 1 in 6 couples have trouble getting pregnant, and 50% of the time there is a male factor involved. And what's also interesting is that when patients end up getting tested, 10% of the time, the if somebody has an abnormal semen analysis, that could signify there could be something else going on. There could be a greater health condition at play. So it's really important for people to come in, get evaluated. Just in my career alone, I've seen that there is a lot more interest and awareness in male factor infertility. When I first started my career, there was this general stigma about it, and the burden of care fell to the female. Many times it was thought that, infertility is primarily a gynecological problem. But times have changed. For one, there's a lot more awareness. Two, nowadays a lot more people are speaking out about their own struggles with infertility, especially male fertility. We see that in some celebrity news, but also the real champions of this are patients that are having one-on-one conversations with their friends, their family, and so forth to raise awareness about male factor infertility. So there's a lot of information out there. Some of it can, be kind of confusing. So I wanted to take the time to go over what I think is most important when it comes to male factor infertility, but also give all of you the opportunity to ask questions so we can, clarify any concerns about male factor for fertility, talk about testing, and, go over what's important in not only evaluation, but also reproductive strategy. So like I said, the proactive inclusion of the male is becoming a lot more mainstream. Male care actually improves the success of both partners when they're trying to conceive. It improves IVF success even in couples that are choosing to do IVF. We want the sperm to be as healthy as possible because it leads to better outcomes. So many times people might want to know, how can they get started in this process? And it's very easy to get started on an evaluation. You can either see myself or one of my colleagues. With the evaluation, we offer both telehealth and in-person consultations. So everyone can learn about what's going on. That process involves getting a history, doing a physical at some point. So if the initial consult is on telehealth, the follow-up can be on, at a time when the physical exam can be conducted. We do some diagnostics, look at hormones, get some semen testing. And then we also spend a lot of time talking about lifestyle modification. We talk about things that people can do on their own to improve their own reproductive strategy. We're also seeing a lot of people that are coming in the preconception space. So they're not trying to conceive a pregnancy right now, but they want to know what they can do now or later on to set them up for success. So we welcome all types of evaluations. Now, there are many different causes of male factor infertility. One of the more common causes that we see on a physical exam is something called a varicocele. These are large dilated veins in the scrotum. And that's something that's really detected upon physical exam. So in general, a man's testicles have to be 2 degrees centigrade cooler than the rest of the body to create an ideal environment for sperm to develop. So if someone has these large dilated veins in the scrotum, over time in some men, they can warm up the testicles, which can lead to an unfriendly environment for sperm to develop. So that's something that, could affect some men as they're having difficulty conceiving. There are many other factors that could influence male factor infertility. We see a lot of patients that might have hormonal abnormalities that can be the reason why they might present with, subfertile semen parameters. So it's really important to come in and get that checked out. Other things that could be going on is that some patients might present with sexual dysfunction, whether it be difficulty, achieving or maintaining an erection, or issues with orgasm or ejaculation that can influence, the couple's ability to conceive. Interestingly enough, one of the most common causes of male factor infertility is that it's idiopathic, which means there's no identifiable cause that we can see that could be contributing to one's abnormalities and with regards to testing. Nonetheless, it is important to come in and rule out some things that could be correctable, that could be affecting male factor infertility, because we're all invested in this journey for all of you, and we want everyone to be set up for success when it comes to achieving their family building goals. So, with regards to hormones, 20% of men that are presenting with infertility have hormonal abnormalities. So that's one in every five men. So we can see this is something that is very common. Nowadays, a lot of patients might be on medications that they don't necessarily know might affect their fertility. One of the more common medications that we see are people that might go into testosterone replacement therapy, also known as TRT. And not everyone is counseled on the effect of TRT, but one thing that's important to understand is that going on any form of synthetic or external testosterone, also known as TRT, can have a negative effect on fertility in the sense that it can serve as a contraceptive. So a lot of patients, after just being on TRT for a few months, might have zero sperm in the ejaculate. So generally, this tends to be correctable. Nonetheless, it's important that if you are taking any of these medications and are trying to conceive in the next few months, make sure you come and get checked out so we can at least have a conversation about the steps that we can take to get your body to start making its own testosterone and or also its own sperm. So Emily, I see that there are some questions that are popping up. Perhaps we can address some of them because I can keep talking for a while about all the different things.
Yeah, absolutely. That was fantastic, by the way. I'm sure it was so helpful. So thank you. The first question here is, what is the best way to improve sperm quality? I've been taking a wide array of vitamins. Any help or advice would be appreciated.
Yeah, absolutely. So let's talk about that. So, with regards to, whenever I see anyone, I put them on prenatal vitamins for men. And these are basically antioxidants. So just so everyone's aware, we have at RMN, we have no brand affiliation for one vitamin company versus another. So it doesn't matter what you're taking, as long as you're taking something. And why do we put people on vitamins? Because there's some data that when people go on antioxidants, it can improve the quality of the sperm. And when I say quality of the sperm, you might notice some changes with regards to the parameters, but I think we're really focusing on the DNA integrity of the sperm. And that's a benefit of going on these prenatal supplements for men. So, and regardless of how you're trying to get pregnant, whether you might be trying to get pregnant naturally or through IUI, which is also known as in utero insemination, that's when you provide a semen sample in the office. We wash it and put it directly into your partner's uterus with a small catheter, or in vitro fertilization. For those of you that don't know what that is, that involves an egg retrieval procedure. Usually multiple eggs are retrieved. We merge the sperm with the eggs and grow embryos in the laboratory, and then can genetically test the embryos and transport them back into the uterus. So regardless of how you're trying to get pregnant, whether it be through natural conception, which is timed intercourse, IUI or IVF, we want your sperm to be as healthy as possible. And that's why there is benefits on going on prenatal supplements for men that can improve the quality of the sperm that you are making. Now, while we're on that subject, let's also talk a little bit about lifestyle because, people always ask us, is that going to make up for, some other things that we might be doing? So in general, when it comes to, we always tell people, of abstain from any smoking, whatsoever, or nicotine products. The same goes for vaping. So that's really important because that can negatively impact the quality of the sperm that you're making. When it comes to alcohol, we get that question a lot. Mild to moderate alcohol is okay, but avoid any binging. And then, When it comes to marijuana, we say the same thing in the sense that, do your best to cut down or abstain from any marijuana that's out there. The data that we have with marijuana is mainly people that smoke marijuana or vape marijuana. There's a lot of patients that might be engaging with edible use or tinctures or so forth. We don't have as much good data on that. So our, general consensus is that, even though it might have some other health benefits for you, when it comes to sperm, it's not been shown to be helpful, might be harmful. So do your best to limit any of that stuff.
Great. We got another question here.
Yeah.
Low morphology. Is there any way to improve it? I know you sort of gave some tips just now, but just specifically low morphology. Yeah.
Yeah. So for those of you that don't know, morphology is sperm shape. And, is a controversial parameter because, in some places, the sperm shape criteria can be incredibly strict. So, with regards to morphology, we used to think historically that the better the looking the sperm were, the more likely they were to swim to the egg and penetrate the egg wall. And then the morphology criteria was changed in about 2010 to be incredibly strict. And, we found that, a lot of patients might present with abnormal morphology, but the other numbers are good, like their sperm concentration, their motility, the progressive motility, which is a movement of the sperm moving forward. So studies have shown that if it's just the morphology that's abnormal, but everything else looks okay, it's less worrisome for us. It may not be as good of a functional test of sperm compared to some of the other parameters. Now, that being said, let's say you have a normal analysis and it's just the morphology that's abnormal, and you're like, hey, could this really mean something? Is this the reason why we're having difficulty conceiving? We invite you to come in because you might benefit from additional sperm functional testing. That is like, kind of like peeling an extra layer of the onion, so to speak, so we can look at the actual function of the sperm when it comes to sperm swimming to the egg or penetrating the egg wall. That might give us some more answers that we're not able to see under traditional semen analysis.
Great. Here's one that just came in. What is ICSI? And does that help if somebody has male infertility and they're going through a cycle? Does ICSI help with that?
Yeah. So ICSI stands for intracytoplasmic sperm ejection. Basically, it's when we take the sperm and inject it in directly into the egg. So, some practices use ICSI for all IVF cycles. Some use it for some cycles. Generally, if there are major abnormalities with either with the sperm, ICSI is kind of like recommended for everyone. With regards to that stuff. Now, if you have surgically extracted sperm, like let's say someone had a vasectomy and we are going to be extracting sperm surgically from that patient, then we have to use ICSI. Any surgically extracted sperm must be used for ICSI, but also if somebody has, other abnormalities with morphology, which is sperm shape, ICSI is what really basically ensures that, the sperm will get into the egg.
Great. Um, let's see. Here's one that came in. Uh, what exactly does a semen analysis check for?
Yeah. So there's a lot of information on a semen analysis. It can kind of be kind of confusing. I've had patients, and I've done this anecdotally, plug in like semen analysis results into your various AI tools, and there's a lot of information out there, some of which might be, not the best information, let's just say. So with the semen analysis, things that I look for, is I look at ejaculate volume, that's how much semen came out. We look at the sperm concentration, which is how many millions of sperm there are per milliliter of ejaculate. We look at the motility of the sperm, which is what percentage of the sperm are moving. We look at the progressive motility, which is what percentage of the sperm are moving forward. And then we also look at the morphology. Now, there's a lot of additional information on the semen analysis, and some patients don't really know what to make of it. So, and also what's important to recognize is that semen analyses are biologic variables, so there can be substantial variability just from one sample to another. So in general, we always like to get two to establish a baseline. If there are, major discrepancies between two samples, then we might get an additional tiebreaker later on. But that being said, if there's any abnormalities that you have on the semen analysis, please, consult with one of your physicians, either your reproductive endocrinologist or your reproductive urologist, so we can kind of go over that with you in detail and see what's important and what to focus on.
Thank you. Um, Here's a question. We've been trying for about 10 months. My wife has a full workup done, and I've had a couple of semen analysis. Do you recommend testing DNA fragmentation?
Yeah. So, so if you've been trying to conceive for 10 months, and are having lack of success and everything seems to be normal, like let's say, your analysis looks good, your partner's workup is fine, you could truly have unexplained infertility. Now, generally, the criteria for infertility, a lot of people say is up to a year of trying on your own. And some people do get pregnant naturally, even in those later months that are approaching a year. But you might benefit from something called sperm functional testing, which is what I talked about earlier. That's peeling an extra layer off the onion. And sperm functional testing, there are many different options out there. DNA fragmentation is an example of a sperm functional test, but it may not be the right test for you. The DNA fragmentation testing looks at the DNA quality of the sperm, but it's really meant for couples if they have had, like a recurrent pregnancy loss or IVF failure, because we want to see, is there an underlying sperm issue that's causing that? For people that are of difficulty getting pregnant naturally, there are additional sperm functional tests that look at the quality of the ability of the sperm to swim to the egg and penetrate the egg wall, and that might be more useful. So, if you are in this situation, definitely come in, so we can at least have a conversation about what might be the right test for you, given your unique situation, because we want to personalize this process for you as much as possible.
So hormones, testosterone, can that affect have on a low sperm count?
Yeah,
Um,
I'm no, absolutely. Yeah. So the way I counsel my patients is think of your testicles like a garden. And immature sperm are seeds, mature sperm are flowers. The amount of testosterone in your testicles is like fertilizer for the soil. So as part of your workup, we look at how much, so we can never measure how much testosterone is in your testicles. So we look at what's happening in your bloodstream, right? In someone that's not on any synthetic testosterone, we want to see what your natural production is. If you have low testosterone in the bloodstream, that could also we could hypothesize that you also have low testosterone in the testicles, ergo not enough fertilizer in the garden. So in those patients, we might put you on some medications to get your testicles to make more of its own testosterone. That could have some benefits with regards to the quality and quantity of the sperm that you're making. Um, Now, let's say your testosterone is well into the normal range, then one can argue there is enough fertilizer in the garden. So just using these medications, empirically without that testing may not be helpful and some people could even, kind of be harmful. So that's why it's really important to get some baseline testing. And as part of your workup, we do look at your hormones and not just, random values. We're looking at the ratio of some hormones to each other to really to see what, if anything, you could benefit from.
Great. What happens at an initial consultation with you? Do you have a conversations? What
Yeah.
exactly, could you walk through that for me?
Yeah, of course. So much, so wherever you are in this journey, whether it be preconception, just getting the process started, or you've been trying for a while and are just, you would like to know what to do, the initial consultation, we spend a lot of time doing the history and the physical. If it's on telehealth, it's basically just the history, but then we also walk through a pathway of, what are going to be some diagnostics that you would benefit from that's going to give us, greater insight into what could be going on. And we talk about, not only the testing, but the timing of the testing that's needed. And that testing could involve some blood work, whether it be looking at hormones, genetics. It could be involving additional testing of your sperm, whether it be just like a basic semen analysis, some advanced semen testing, sperm functional testing. The physical exam has to be, is an important part of the consultation at some point. So let's say you're going to see us on telehealth. And by the way, we love telehealth. It's really expanded our clinical footprint, in the sense that like no matter where you are, we can be part of this conversation with you to get you started in this process. So we don't want people to think that, geography is a barrier. So if you can't come in and see us in a clinic, at least we can get you started on this journey. So in anyways, the exam is going to be important at some point because we want to see, is there anything on your exam that could be impeding this process or contributing to abnormalities and parameters? Um, so then, so think of it as like a three-step process. Initial visit, which can be, in person or telehealth, diagnostics, and then a treatment plan visit. And that's really where a lot of the discussion comes in. Now, that being said, at the initial visit, we are going to spend a lot of time talking about reproductive strategy, and that is what can you do from a lifestyle standpoint to put yourself in a better spot when it comes to building a family. We also want to get an idea, what are your family building goals? Like, how many children do you want? What is your timeline for all of that? Because all of that will impact how we will go about this process. And the most important thing to understand is like we want to personalize this process, because what might be right for, one couple might be completely different for another couple, or what might be right for one male patient might be completely different for another male patient, depending on where they are in this process and what they want to do. So, that being said, everyone has their own journey. That journey is unique. We're hopeful and we're excited to be part of this process with you. So all of these things will be addressed.
Great. If somebody has zero sperm, is there still hope to have biological children?
Yeah. So zero sperm, in the ejaculate, the formal name for that is something called azospermia. So when somebody has azospermia, like let's say you've done a couple of semen analyses and, have had that result, we want to figure out why that is. And, you could have like a blockage that's called obstructive azospermia, or there could be like a sperm production issue. And that's abbreviated as NOA, also known as non-obstructive azospermia. So initially, you want to figure out where you are in this process, where you are, from that standpoint. Some diagnostics and the exam is going to help us in that process. Now, let's say you had a vasectomy, then, that's an obvious reason why you could be obstructed. But sometimes people can be obstructed without having any surgeries whatsoever. One reason why someone might have obstructive azospermia is they're missing the basic canal, or they might be missing part of the vas deferens is important in the transport of sperm. So that's where the exam comes in. Prior surgeries, could also cause scar tissue. Sometimes infections can also do that. Um, if somebody has a sperm production issue, there could be a genetic reason for why that is. There could be, that could be hormonal. Like if someone's on testosterone replacement therapy, that's a reason why someone might have, a sperm production issue, because that shuts off that process. It could also be completely idiopathic. Like we don't know why you have a sperm production issue. Now, that being said, we want to figure out what's the right process for you. So let's say you have a blockage, and you had a vasectomy. One option could be, do you want to reverse that vasectomy? Or, another option is could we extract sperm that we can use for in vitro fertilization? If you have a sperm production issue and we can't get you to be making sperm, some of these men could have some sperm in rare pockets in their testicle. And, with surgery, we can extract sperm in some people and utilize that sperm for IVF. So initially, if you have that diagnosis, we don't, we want to do whatever we can to help you achieve your family building goals, but we have to get some more information to see what's going on so we can steer you in the right direction.
Great. Here's a question that just came in. If you try to conceive every day in the female fertile window, does it affect sperm quality/quantity?
So in general, when couples are trying to conceive, we actually recommend they have, unprotected intercourse like every other day. That has been shown to be more helpful in the process. Just something that while we're talking about this, something that we also see in patients is that we see a lot of people with something called situational erectile dysfunction, which means they have no issues with erections at baseline, everything's fine. But, if they're having like constantly frequent intercourse during this process, sex becomes kind of like homework, all the time with this end goal, there are a lot of men that can have some, situational erectile dysfunction during all of this. And that can be, like a cause of distress for not only the male patient, but also for the couple in general. So, generally, if couples are having sex every other day, starting a week before when you think you might be ovulating, because nothing's going to be perfect, from that standpoint, it does help. We can also put people on some medications, such as like Viagra, Levitra, Cialis. Those are the most common medications that are out there that can help some people that are having some, situational or non-situational erectile dysfunction in this process.
This question kind of sort of goes along with that. If you have a semen analysis, how long should you abstain from before the semen analysis?
Yeah, so we generally tell people to have 2 to 5 days of abstinence. Sperm don't live very long, but if you don't have 2 days of abstinence, that might lead to lower, it might need me have be inaccurate in terms of the volume and also the concentration. Now, if you wait more than 5 days, that can also lead to lower morphology and lower motility because the sample could just have a lot of like dead or decaying sperm in that process.
Great.
So that's why we always say 2 to 5 days.
Um, uh, Alcohol, drinking. I think you mentioned this. Somebody said, how much does it actually affect um, the sperm quality?
Yeah. So, obviously everyone's body is different. And there's some people that, drink a lot and has no effect. And there's some people that drink, basically little or a mild amount of alcohol and they have more of a dramatic effect. So we just tell couples that in general, the go-to answer is, mild to moderate alcohol is okay. Avoid any binging. And everyone wants to know how many drinks is that, right? And I wish I could tell you that because everyone's body is a little bit different when it comes to that stuff. So we always say that like less is better than a lot, and do whatever you can to you know be mindful of the alcohol intake that you have.
Great. This next question is sort of on the same lines. Stress. Um, I guess how can it affect
Yeah.
the sperm quality and quantity?
Yeah, well, we know that stress can affect your hormones. There are a lot of studies that have shown that, when people are in situations of stress, and we have this data when it comes to military recruits during times of combat versus times of like, just training, their hormones can be very different. And hormones affect sperm, and there's also like an underlying effect of stress on sperm that, has been not been able to quantify. So we don't know why some people, even if they have normal hormones, if they have a lot of stress in their lives, that can lead to abnormalities when it comes to fertility outcomes for both the not only the male but also the couple in general. So I know that's easier said than done. I wish I could like wave a magic wand and tell you, oh, live a stress-free life, but I always say it's mindful to be do whatever you can in your life to decrease stress during this process. Sometimes it involves taking breaks, when it comes to fertility, if that's the cause of your stress, or focusing in other aspects in your life to do whatever you can to decrease stress. We have patients that also, see fertility therapists because that helps in the process. We have patients that do all sorts of things like meditation, acupuncture. I know a lot of this stuff is easier said than done, but just be mindful of that as you go through this process. And we're there to support you also. So if relieving your stress involves asking us more questions, being more involved with us, like let us know. We're always here for you guys.
Thank you. And I think we have time for one more question. Um, so this one just came in, STDs. If somebody had STDs, they were treated, can it still affect your fertility?
Yeah, so when it comes to some STDs in men, namely we think about gonorrhea and chlamydia, it can cause scarring of the reproductive ducts. It can also cause scarring in the epididymis, so it can affect fertility in that way. So if you have by the same token, people can have something called epididymitis or chronic epididymitis. The epididymis is a storage chamber for sperm. For guys, it's like the lima bean structure up and around your testicle that feels kind of soft. It's like a lump there. There's some people that can have recurrent bouts of epididymitis that can cause just scarring of that area. And that's the reason why some people can have, if it happens on both sides, can develop something called obstructive azoospermia. Oh,
Great.
another question that I also get that I want to talk about is that sometimes there can be some concerns. Oh, is this workup going to be expensive? Do I have, is the male fertility stuff covered by insurance? There are a lot of nowadays with more awareness about male factor infertility, a lot of patients might have insurances that cover a lot of the testing that we offer, certainly the consultations and the blood work, but also some insurances might cover the semen testing. So there are something called fertility benefit managers. That's something that people have on top of insurance. We see that a lot in companies that have a like large number of employees that might offer those. So if people have any concerns, just check with your HR people, at your work to see if they offer fertility benefits. A lot of patients, at least a lot of the guys that I see have this and don't even know they have it. And that covers a lot of their testing also. And it may also cover treatments like if they need surgeries and so forth. and may also extend to their partner if they need coverage for, fertility treatments such as insemination or in vitro fertilization.
Great. Well, thank you so much, Dr. Mason. This was such helpful information. I think, everybody got a lot out of this. But so everyone, thank you for joining us tonight. This was great. Follow us on Instagram, on Facebook. We'll be doing so many more of these, and hopefully we can have Dr. Mason back to do another one. Yeah, thank you, everyone. Head over to the rmanetwork.com to make an appointment. Thank
Yeah.
you.
Thank you, everyone.